One thing that kind of drives me crazy is that people come in and they spend a whole bunch of money on services, injectables, Botox, maybe even facelift surgery, laser, anything that gets done here. And then they tell me that they're using oil of Olay or some sort of drugstore cream or something they get from a cosmetic counter. And they're not really paying attention to what they're using on their skin. And I think there are people who will spend hundreds, if not thousands of dollars on these skincare regimens that actually do absolutely nothing. So I think it's so important that if you're going to be paying attention to your appearance, you've got to really get quality skincare. And that means medical grade skincare, because there's nothing else on the market that has been tested, biologic, biopsy proven, tested, like these medical grade skincare lines. My line that I have here, that I work very closely with a chemist from Yale University and developing, is just that. It's something that has been biopsy proven, tried and true, time and time again. It's gonna allow you to get improvement in the quality, tone, and texture of your skin, and it's gonna maintain youthful skin. It's gonna actually go to the depths of your dermis, and it's going to affect changes that are going to give you long-term lasting results. So one thing that I think everybody should be on is some sort of medical grade retinol. Sometimes it's a difficult thing to get on because it can tend towards making people a little bit dry and red and irritated if you happen to have sensitive skin. But that doesn't mean you should abandon it completely. I work with people and I like to follow up on how they're doing with their skincare, because I think that part of your treatment plan is so important that even though it seems like a minor thing, that's a gradual, you might not notice something overnight. Over the years, it's something that I have seen to keep people looking young with doing very minimal things, just washing your face and using appropriate product. So it's one of those things that it's a very minimal effort. It's just a matter of washing your face and using appropriate products once or twice a day. It's no more than brushing your teeth at night, which hopefully everybody's doing anyway. So I would just love to get everybody onto a really good skincare regimen that works for them. And to that end, I will work with you, see you back, add products in one at a time so we could see over time what's actually working for you, and then get you on a regimen that's working for you. I have women who come into my office who, for example, were put on Retin-A when they were in their teens, and they were put on it for acne at the time. And now it's 30 years later, and they're coming into my practice, and they've used Retin-A their whole life. And their skin looks honestly like they are in their early 20s. It is magical what it's done. I mean, you have to have a little bit of belief in it, but I've seen it time and time again. So that's one thing that I like to try and get all my patients on. It's rare that I can't get somebody at least on a low dose of retinol that will keep you young without irritating you too much. And we'll start on a regimen of maybe once every third night and see how you do for a couple of weeks. And then if you're doing okay, we'll bump it up to every other night. And we'll try and build up that tolerance for it until you're on the strongest dose for as often as you can use it, because that is one thing I know is going to keep your skin looking beautiful for the rest of your life. And it's going to add to all the other procedures and things that you're doing to keep yourself looking young and great.